Hi, everyone. Welcome back to Inumi. If you're new here, this is a place where we talk about the emotional side of being a human. The parts we don't always show, the parts that feel heavy, the parts that are quietly rebuilding us. Before we begin, take one breath with me. Inhale for 4 and exhale for 4. Today's conversation is tender and important. We're talking about something that we don't always see. It's the human side of medicine. And I'm honored and happy, and I can't explain how excited I am to talk to Dr. Kristen Fox, and I'm welcoming her. Kristen. Um, Kristen is a pediatric resident. She cares for children in clinics as their regular pediatrician, and she also cares for hospitalized children, including some who are very sick. But today we're not just talking about medicine, we're talking about heart, about emotional weight, about hope in hard places. Kristen, thanks for being here.
Of course, I'm happy to be on.
Kristen, when people think about doctors, especially pediatricians, I know when I had my son, first time mom, and I was like, don't you dare hurt my kid. Like I wanted to fight him. So like I just, they're really often they often imagine when they think of pediatricians as strength and composure and professionalism. But what is the emotional side of caring for very sick children?
I think that, whenever I try to approach families, whether it's in the clinic, when their child is healthy and they have, a small complaint, like they have spit ups after a refeed, or if I'm in the hospital with a kid that may be dying, um, I think it is extremely important to let the parents and the patients, if they're able, to just have this space to give you their perspective and to speak out any concerns or complaints. So anytime I start talking to a patient or family, I kind of just start off asking them how they're doing, um, and how they're feeling today specifically, and kind of just letting them air out any grievances, because you can really learn a lot just by, I know it sounds like
You can.
intuitive, but you can really learn a lot just by listening to people.
Yeah.
um, and just getting a look at their body language, the tone of their voice, you kind of know what kind of hat you need to put on, in order to gear the conversation so that it goes in the most productive way possible. So I think there's a lot of emotional intelligence that comes, especially with dealing with parents, um, because they're trusting you to take care of the most important thing in the world to them.
Exactly.
So you really need to make sure that you're like honing in on those cues that they're giving you, their body language, the tone of their voice, really listening to their concerns, no matter how big or small they may seem to you, and just validating them as much as you can.
Right. Yeah, it's so important, like for the doctors to come and talk to you and just soft-handed. I mean, my son, this kid, I swear he should have owned like a wing of the hospital. He was in there all the time, and it always happened at night. So, you're dead asleep, and your kid comes and stares at you in the face and it's like, Mommy, we have to go to the hospital. I'm like, what are you talking about? So I'm freaking out right away. So when you see the doctors, it's just awesome when they're chill and they can bring you from 10 to at least 5, you know? Um, I have a bunch of questions to ask you, but the one question I do want to ask you is what made you decide to go into this field? And can you give me, I know we know each other for a little bit, so I know some really great stories of yours. And but what made you decide? That's the one thing I didn't know about you. What made you decide to go into this field? And um, I know you. Well, tell me, what part is your favorite part? How about that? So
Um,
tell me why you went into it and what you like the best part about it.
sure. Um, so I actually didn't know that I wanted to be a doctor. When I was little, I thought I wanted to be a veterinarian,
I remember
which sometimes in pediatrics it feels like that. Um,
that.
uh, I, in high school, started getting really interested in psychology, and that was actually my major in college. While I was taking those classes, I noticed that I liked the child psychology part of it more. And I started volunteering at Nicholas Children's Hospital in Miami with a team of people called child life specialists. Um, they specialize in like behaviors and development in children and kind of make the whole hospital experience a little bit better by speaking to kids in ways that are developmentally appropriate. So they use things like dolls and teddy bears to explain like procedures to kids and stuff like that. And while
They should do that
I
with
was
some adults, meaning me. Good.
um, and while I was doing that, that was like the first couple of years of college. I just noted that like when I was in there with the kids, um, I liked that part a lot, but I also liked just watching the doctors come in with the residents and watching them doing their rounds and kind of just listening to their thought processes on how they tried to figure out what was going on with the child, if it was like kind of a mystery. And kind of just gearing every conversation towards like what was best for the patient and the family. All of that was really interesting to me. Um, so then I started trying to go into medical school. While in medical school, I realized that I absolutely hate adults. So I went into pediatrics. Right now, I'm doing my residency. I'm in my second of 3 years. And then I'm actually applying to do a fellowship in hematology and oncology. So I will be specializing in kids with blood disorders and cancer.
Wow. And you actually did and I'm only being like, you know, dust off my shoulders because I knew you. A presentation in a huge hospital in, was it California? You went to California? The
uh, I presented at a conference in
There
San
you go.
Antonio
Oh,
right before I started med school. I've done a couple of other things since then. While in medical school, I published a couple papers. I also did a conference up in Orlando. And then now in residency, I'm continuing to do a bunch of
and you were
projects.
doing that even before you were president. I remember
Yeah.
the story, and I was like, "Go ahead, Kristen." I love that for you. So what was the first moment that really hit you emotionally in this field? Do you remember
um,
a case that changed you?
yeah, it actually happened before I even started med school. It was when I was volunteering with the child life department. Um, One of the things that they also do is for kids that are very sick, they will help make like memory things for parents. Um, and I had a patient that was 16, which is like a really tough age, I think, to be like a very sick kid because if they're developmentally
100%.
appropriate, they know what's going on. It's
Yeah,
not like a surprise to them that they're
right.
dying sometimes.
God.
Um, and I got really close to her and to her family. Um, at this point, I was maybe only like 4 or 5 years older than her. Um, and with the child life department, we like knew she was gonna pass away soon. Um, we made this like little painting. I had basically like drawn out like the trunk and some branches of a tree, and then we dipped her fingers in different shades of green, and used those to make like leaves
Oh my
on
God.
the tree, and then we gave that to her parents. Um,
Oh,
and then
I can't even.
um,
You're gonna have me crying in 2 seconds. Go ahead, go.
and then she unfortunately passed away like about a week later. But it was, and I was in the room. I like got there literally like 30 minutes before she passed. And like I said, I got him really close to the family and to the patient. They asked for me to be in the room. So I was in there with them when she passed, and they had the little canvas that we made, and they thanked me for it. Um, so that was like, it seems like one of the things that would like deter people from that. Like, I think a lot of
Yeah,
people would experience that and be like, hell no, I cannot do this at all.
yeah,
Um, for me, it just felt like such a privilege to be able to be a part of that and to be trusted and like welcomed into that family in that way.
yeah.
So I was like, really, when I was like, okay, yeah, all this like studying and working my ass off that I'm doing, gonna be totally worth it.
Wow. I mean, I volunteered at Joe DiMaggio because I
Mhm.
mean we all I'm a hairdresser. I've done it for 40 years, but um, now different career path. Anyway, I did work at Joe DiMaggio, and you do like get attached. There was this one girl who was on life support, and I was doing the mom and the aunt's hair,
Mhm.
and they were like, "Come visit her and come see her," and then they ended up bringing her home for a little while, and they were like, "Come over and come," and I didn't know how to handle that. I said no only because I know that I probably would have fell apart, at her birthday party. Well, I just couldn't do it. So I can't imagine how you can do it like every day. I'd probably be in the corner sucking my thumb or something. Um, when parents, I can't. That's just me. When parents are scared or overwhelmed, how do you hold space for them while they're while also holding yourself together?
Um, it's definitely something I've gotten better at over time. Um, but I think whenever I'm going into a parent's room, or to a patient's room and the parents are there, um, I remind myself that this is not about me. Um, and it's like, it can be really hard, especially in the beginning, to like take yourself out of it,
Disconnect, yeah.
to like disconnect kind of while still trying to be there, be present, and showing empathy, and showing like you care.
How do you do that? How do you cut off your feelings but yet still show empathy?
I think the way I do it, kind of like going
Yeah.
back to what I was saying in the beginning, first just like opening up the space and allowing them to say whatever they need to say. I mean, I've had parents crying at me, I've had parents yelling at me. I had a patient pass away, and a mom looked me right in the eye and told me she's not a mom anymore. And those things are like very difficult to hear. But there's just like, and maybe it's like a personality thing, but there's just like a part of me that like knows that in that moment it's not about me. Um, and I just like try to be as present as I can be with the patients. And then as soon as I leave the room, I go to the bathroom and I set a timer for like 5 minutes and I let myself cry.
That was really going to be my next question because I think sometimes people forget like doctors are human.
I,
You're human first, and so it's like what does the human part of you feel in those rooms?
I have
Like
cried all over the hospital.
they should have space in the hospital, like little closets, like decorate. You should
It's
pitch that to
truly
them. You should
like call
because
rooms, stairwells, all over the place.
they should
People walk
have
by and I'm like,
this.
hi.
Like you guys need, I mean, and I'm not saying you per se, but like you guys need a place to be able to either release or talk to somebody or just like an anger room, like just go beat the hell out of something because I'm sure, or I think, I don't know, I can't say I'm sure, but when you get close to somebody that way and they pass, there's different levels of grief. I'm sure you want to go out and just beat the crap out of something. I mean, I know I would. I'm like baseball bat in a tree. Let's go. You know. So you guys need rooms. Um, there's something sacred about caring for someone at their most vulnerable, but that has to take like its toll. So how do you cope after a hard day? So you just said that you go and you cry, but what do you do after a hard day at work?
um, I am very fortunate that I am in training with a lot of other really great people. Um, and as much as I talk about it with like my family or like friends that are not in medicine, nobody understands it as well as like the people that are right there with me.
Uh-huh.
Um, so I do lean a lot on my co-residents, and like fellows that I work with in different departments, just like different people throughout the hospital. Um, but I also just go back to like all of the other things I use to deal with stress. I go to the gym, I read a book, run, hang out with my dog. um,
That's wow. Do you bring it home with you, or you could check it at the door?
I try to leave it at work as much as I can, but there are some patients that just really stick with you, and they're like the last thing you think about when you go to sleep and the first thing you think about in the morning, and then you get stuck and you're checking your phone, seeing where they are and what's going on with them, looking at all the updates, and you're texting people in the hospital like what's going on.
I couldn't do like I'm
I've
sitting
had
like, like
I've had nightmares about patients where I'm just like I'm so in like the ditch with them that I'm like having nightmares that they passed away and I wasn't there and somebody's asking for me and I'm like running to get to the hospital and
oh my god. Well,
so
that,
I try my best to leave it there, but sometimes it just these kids just like I feel like especially with children they just like
yeah.
stick with you so hard.
I mean, not for anything. I used to work at Entenmann's, okay? So, and I used to have nightmares about the donuts coming at me. I can't imagine you like not having nightmares. Like I could, I don't know how you function. Okay, whatever. Hats off. Is there guilt when you step away and try to reset and try to rest?
I don't think so. I
Good.
feel like um and I've gotten better with it over time with just like reminding myself that I am a human being and I'm not like this machine. Um, and just giving myself grace and acknowledging the days that I don't show up at like my very best. And sometimes it does feel like that. Sometimes I'm like, I feel like today I'm just not that good of a doctor.
Oh wow.
um,
Yeah, I get it. Mhm.
and it's not because I'm
It's
not trying or anything. You're just like out of it. Or you're so tired because we work so much
mhm.
all the time. Like any residency program has an 80-hour work limit for the week, and that's like,
Dude, 80
um,
hours? I mean, at one point I was doing 72 and I thought I'd die, but 80? Yeah, absolutely.
yeah. So like sometimes you're just exhausted, and like you're not like showing up as your best self, but sometimes you get to the hospital and you feel like that, and then you walk in the room and you're like, great, now I gotta do it, and you
Yeah.
just like power through. But
Right.
I think
Hairdresser
like
mode. That's it. Flip that switch and go.
yeah, I'm like, what am I gonna do? Like, I'm not gonna be like bad today because I'm tired.
You could never
Like,
be.
like my tired compared to like this kid's cancer or heart failure or whatever. Very like not exactly apples to apples.
Right. No,
Uh,
you're yeah. I can't. What do you wish people understood about the medical profession that they maybe don't see?
um, I think a lot of people don't understand what the training is like. Um,
Yeah.
the, especially in like an academic hospital, you have medical students, residents, fellows, attendings, and like those four words mean nothing to a lot of people, and like they don't know. They don't know like, and sometimes when the kids are like very complex, they have a lot of different teams working with them, and they don't know, and all those different teams each have their own resident and fellow and attending, and there's just
Right.
so many moving parts, and people just I wish there was just like a little bit more education out there for the public about like what the steps of training are, because there are like some things that I'm just not qualified to answer.
Right.
Mm. And when it's like 3 o'clock
Good
in the
point.
morning and you're on like hour 21 of your 24-hour shift, and they're asking you about like why they started this cardiac medication, and I'm like, I don't know, I'm not a cardiologist.
Right. Right.
Like,
Right.
that's what I know. And they're like, but why don't you know? And I'm like, because I'm not a cardiologist.
Not my department. It's not
Yeah.
my lane.
not my
Wow.
not my circus.
Yeah. Right.
Yeah,
I.
and
I
I'm
It's funny because like when um, one of my surgeries, I had so many different people coming in, and I was so excited because I was lucky enough that they were all from different like countries,
Mhm.
and I'm like, oh, where are you from? Oh, where? Tell me about it. So they thought I was weird, but most people do, and that's fine. But I joke around with them because I'm thinking to me in my head, you guys have the hardest job, I think personally in the world. Like if it was up to me, there'd be a lot of dead people because I'm not doing it. So like I respect you guys so much that, and I feel bad because I know you have to deal with a lot of emotions all the time besides figuring out what you're doing, your knowledge and all that. So I'm like, I'm gonna goof with them because if I can make them laugh for the day or a little giggle, maybe they'll feel a little bit better, you know? Um, you had mentioned like finding moments of hope. What does that look like in real life? Like, is it small wins? Is it the resilience of children? Is it the families? Like,
Sometimes it is really small things. Like you'll have a kid that's admitted because they had the flu and they just haven't been able to keep anything down for days and they just need to be in the hospital because they need IV fluids. And then one day they eat a pizza and you're like, holy shit, like this is the best day ever. Like this kid ate a slice of pizza. I was like, yes, well done you. Other times it's like much bigger things. Like during my first year of residency, I had met a baby that was 9 months old and was born with like a congenital heart defect, um, and was doing really, really poorly. Ended up in like the intensive care unit for months. Was in the hospital for almost his whole life. He had only gone home for like 5 days before he had to show up to the hospital. It was really tricky because mom had a whole bunch of other kids, and they lived in another state, so it was like, parents weren't always there. We were having to call them in the middle of like these really busy days.
And where are you located again? I'm sorry.
I'm in New York.
Okay.
Yeah.
So it's overly populated there to begin with. Oh God, go ahead.
Yeah, but then you have like our we get like a lot of patients also from like Philly or Jersey, like things that are easy to get to. And this poor kid was just doing really, really badly. And I went back to the cardiology unit this year. At this point, he had gotten a new heart and had been discharged from the hospital for a while. And I was just there on like a normal day, and I saw him walk into the hospital. He had like a little book bag, his little shoes, and he was like waddling down the hall. And I was like, oh my God, there's like last time I saw this kid, he was like on death's door. And now he's like a toddler and he's doing amazing. So like those moments are like outweigh the bad ones by far.
Oh my
amazing.
God.
This kid has like his whole life ahead of him now.
And how, when he saw you, was he like, hi? Just like run over to you and stuff?
I mean, his mom had a more visceral reaction to me because he was
right.
like months old when I met him. So
right.
Person, but his mom was like, "Oh my God, can I please stop walking?"
Oh wow, yeah, no, wow, that's huge. So what has surprised you most about the kids? Like just kids in general. What surprises you with people the kids you've dealt with? What's the most?
I think just like truly how resilient they are is like incredible. Things that would just never happen in the adult world.
Right. Yeah, they have a different like mindset, kind of.
I take care of kids that have like devices that basically pump the blood through their body, acting like their heart, and it's like literally hanging out of their body in like a little machine, and they're like rolling down the hallways on their IV poles.
What?
Like going around with physical therapy with this machine on their like tricycle. And I'm like, hi, how you doing?
Wow.
Like an adult would
They would never do that.
They would be like, my arm hurts and now I'm like bed bound and like can't do anything. Kids are like, if this thing stops, they die in like 30 seconds, and they're like, it's cool.
Oh my God.
They're just like truly so incredible. I see them sometimes and I'm like, I can't believe you're real.
That's so freaking cool. So what keeps you choosing this field every day? What makes you like get up every morning and do this?
I think it's a couple things. First, I like really do get very close with my patients and their families. So like being that like champion and advocate for them, in like every space that I can be, really is just like such a big calling for me. Those like moments, like watching that kid walk down the hall after I thought he was gonna die.
Right.
Those moments are just like, they're so incredible. There's like nothing like it. It's like such a high.
Yeah.
And then also I love my job. It's like so stimulating. Like no day is ever like the one before. Especially with kids that like being a baby and being a toddler, being a school-age kid and being a teenager are like totally different lives. And like the things that make them sick are different. So like all of them react differently to the same disease or same infection or whatever.
Right.
So it also just like keeps me going all the time, and like I'm such a curious person, and like always like asking questions and like doing research and trying to be informed, and um, I think that also just like scratches that itch in me.
Yeah.
Also, while just letting me be like goofy and silly because they're kids.
Uh-huh. Do you wear the red nose?
I don't, because I'm terrified of clowns.
Are you really? I
Yeah,
can with that, you know.
I'm terrified.
We can hypnotize you to get rid of that.
But I wear like I have a sweatshirt on right now that has dinosaurs on it.
Yes, cute.
Bows that I wear in my head, just a whole bunch of silly things that the kids all like.
I love that. Okay, so where do you personally refill your own hope?
I think kind of going back, just like seeing my own patients. There are like so many days in my job that I come back and I'm like, I'm exhausted, but I feel so good about everything that happened today. And it just like feels like you're doing something. I never feel like I'm doing something unimportant. So it's like such a fulfilling thing, and like, and there are days where I'm like not really dealing with sick kids. It's just like regular like clinic, and they're just taking their babies for vaccines and like well child visits, and
But that's huge.
and I'm just like,
yeah.
no, it's just like in comparison to the things that happen.
Yeah.
It feels so small.
Yeah.
But even when I'm just like in clinic, like giving parents like counseling on how to start solids with their baby, or like what this vaccine's for, or like what foods to avoid, or oh, this poop is normal. Like sometimes it's just like I can see like the peace that parents get from just talking to me for a couple minutes, and that already just like makes me feel good and feel like I did something that mattered that day. So it's just like it's hard to like really have like a date that's fully horrible.
Right. So has this job changed how you see life?
Yeah.
How?
I think there are just like so many things that we take for granted, and so many things that it just puts like a lot of things into perspective. I kind of mentioned it before where I'm just like, I'm so tired, but then I'm looking at this family and I'm like, I can't even imagine how they're feeling, because they're also here at like the same hours that I'm here, but they also have like their kid
Right.
that's sick, and they have other kids at home that they have to worry about. They have to worry about finances and like just all the things that come with dealing with a child that's in the hospital or dealing with a child that's sick. Like I'll see patients even in clinics sometimes that are more complex. You know, they have like feeding tubes and are on a bunch of medications for seizures and just a whole bunch of things. And like every time I'm prepping for them, I'm like, oh my god, this kid has so much going on. And then I see them and I'm like, yeah, I have to deal with it for 45 minutes. These parents like go home and they take care of these kids. Like this is their every single day.
Yeah.
So as like someone who's not a parent yet but wants to be one day, I think I've just like gained so much appreciation for like what parenthood is, and like how much people like you who are mothers are willing to sacrifice for their children.
Shh, don't tell them.
Like they don't know.
So how has it changed how you love the people in your own world? Not the patients, the people in just your world. How did it change? Or did it?
I think it has too. I just seeing all those things, it like makes me appreciate the people that were in my life before it all so much. And they really are just like such a good escape for me. But also just like remind me not to take them for granted.
Yeah.
To like reach out to the people I don't normally reach out to, or just like spend that extra 5 minutes talking to my grandma on the phone. I'm exhausted.
Yeah, you love your grandma. I'm just sitting here thinking like, how closer could she get to her family? Because I love that your family is so tight. You know, it's just so cool. And I know you guys prop each other up. You know, it's awesome.
I've also unofficially become the family pediatrician. I will get text messages and pictures of things at 3 o'clock in the morning. And I'm like, it's normal.
Stop sending me poop pictures. I don't want to see it.
Yes, yes, he's very cute. He's fine.
So how do you, I think we touched on this, but I'm going to ask you just in case. How do you protect your own heart but still keep it open?
um, yeah, I think, kind of like I said earlier, just like giving myself grace and forgiveness, which is not like an easy thing to do, and I was definitely way harder on myself when I
Yeah.
first started residency. Um, I think it like takes a lot of self-reflection and being like reminding yourself of how much you actually do, um, and forgiving yourself when you do fall short, because it's gonna happen. Like, we're
Yeah.
all human. There's gonna be a day where you're just like not that good at what you're doing.
Do you
um,
feel
or you like say something that comes off the wrong way or something, and then you
it's like I'm doing a YouTube? Okay, get ready. It's going to be a surprise to me, just like it's a surprise to you. It's like, um, so yeah, that balance feels really, really delicate because I mean, just in general, when people are sad for long periods of time or whatever, they just kind of become like despondent, and it's like, how do you not become despondent with all that sadness and trauma that you see?
yeah. And I think it like goes back to those moments that are like, there are times where I'm like really stuck in a room with a patient and their family, and it's like a horrible conversation, and like nothing about it feels good. And there's like a lot of, as like a person who's not in training in medicine, I think there's like a lot of times people like view it as like we're not trying hard enough, or like we don't know what's going on, and like sometimes we really don't know what's going on. So there's like a lot of like parts of being in medicine that feel uncomfortable because we don't always have like all the information. We don't always, we're not wizards. We can't like predict what's going to happen in the future for every patient. We know like trends and things, like historically how things go, but every like person's different. Everybody's like body's different. So like for some kid, one thing might not be that big of a deal. For another, they could end up intubated in the ICU or something.
Right.
So there's like a lot of like moments that just like don't feel comfortable, and sometimes you'll leave those rooms and it's horrible, but like I always just think like there's another kid at the end of it, and you have to like go up and give your best self for that kid too, because they deserve it, even if they are just there because they haven't been able to eat for a couple days.
Right. So what would you say to someone who wants to go into medicine but feels afraid of the emotional weight?
I think that I've alluded to a lot of this already, there are a lot of moments in medicine that are truly just heartbreaking and devastating and will like tear you down to the bone. There are like faces that will stick with you and stories and all these things, but I just think at the end of the day, it just means that if things are impacting you that much, it means you care. And people that don't care shouldn't be in medicine.
Right.
So I think if you're already thinking about like how much you're gonna care, I think you're like already on the road to being a good doctor. And it's not an easy path by any means.
No.
It took me years and years and years to get here. I had to apply to my 3 times, and I would do it all over again because I love my job. But like being emotional about your patients doesn't mean they're not cut out for this.
Right.
I think managing your emotions is like the hardest part about it, but I do think emotions need to be involved for you to be like truly a good, well-rounded doctor. And that's something that like will come over time.
Right. So do you think that because it is a lot. I mean, I know you were hours and hours and hours in school and hours of studying and hours. I mean, you were just constant. Do you think that for you it was running and exercising that kept you pretty much level? Yeah.
I think that, and also just like kind of like going back to your reason for doing this. Like remembering your why is such an important part of this whole process. Um, for me, it did have to do with like the connections that I made with families and um, things like that. So like even when I was like, I mean, even now, like I said, I'll go into a room and feel like shit about it, and then go to the next one and be like, well, now I like really need to show up because there's like another kid in the next room. Um, and like that was like my whole reason for going into this. So like really going back to like your whole purpose for going into this, and like your um just like your reasons for going into the field, I think are really important. And then also just like leaning on the people who care about you, and like being open to asking for help, which is not something I was always good at.
Yes, it's so hard.
It's so hard to do that. Um, but like just like being honest with yourself and being like, I actually can't do this by myself. And I think like the more I've realized that, the more I've been able to handle a lot of things. And have been like really bad days. I've like gone to patients' funerals and things, and those days are like really really hard. But now I like will text my sister or my friends from work and be like, hey, I just went to this kid's funeral. What are you doing? Like, I don't want to be home alone right now.
Right.
So
Wow.
just like leaning on people a lot.
Now, did you take like with all the madness that you were, because like I said I've known you forever, so all the studying and everything and the stress and all that, did you take time out, like did you ever just out of a 7-day week, did you ever just take a day and just do what Kristen wanted to do, or were you always just in the books 24/7?
Um, no, I definitely do that. And I think I've gotten better at doing that actually. As time has gone on, even though my time feels like less now.
Yeah.
Um, to just like do the things that I enjoy, whether it's like going for a run or a workout or reading a book or just like something silly like painting my nails or something.
Yeah.
Just like little things, just fill up your cup, because like you can't show up and be there for people when you're like running out of fuel yourself.
Yeah, 100%. Um, so before we close, what would you say to a parent sitting in a room right now, from a doctor's perspective and a human perspective, because you are very sweet, human-like, and she, what like you said, a parent is going through massive emotions at that point, and you're honestly, I mean, I know from being in the hospital with my kid, looking at the doctors like, you guys are my saviors. Tell me something. So, what would you tell a parent sitting in the hospital right now?
Um, like I said, I will usually go in and ask them how they're feeling about the day. Um, and I always like to ask, what questions do you have, instead of do you have any questions? Because I feel like that opens it up more.
Right.
Do you have any questions? Could be like a yes or no thing.
Right.
What questions do you have? Kind of just opens it up to like
Right.
everything. And I will usually kind of like close out by like trying to validate whatever it is they're saying. Like I understand that you're worried about this, and I hear you, and that's why they're here, and we have this whole team here that is really trying to take care of them, and we are all working very hard to get to the bottom of maybe what is causing this. And we know the medicine, but you know your child, and every child's different, so like any concerns that you have or anything different that you notice, please let us know, so that we can all get together and use that information along with the knowledge that we have to all work as a team with you included to do the best thing that we can for your child.
That's awesome. So it's kind of like you're taking everything. You're taking even the little factors to get to the goal, basically. Then
Mhm.
that's awesome. You're awesome. And and what would you say to someone who feels like they're losing hope? Because that's definitely something that when you're overwhelmed and stuff.
Um, I think again, just like reminding them that we're all on the same team. That like all of us have the goal to do what's best for their child. And that we understand that this is probably like one of the most important people in the world to them. Um, and I think it's also really important to clarify with parents what their goals are for their kid.
Yeah.
Um, because sometimes like giving the most amount of medications or doing this surgery or this procedure is not the best thing for their kid. Sometimes it's like actually letting them go in a way that um, makes them comfortable in like as little amount of pain as possible. But if we, I think as doctors, we have like an inclination to like always try to fix everything. And sometimes that's like not actually the best thing for the patient. It actually just makes them suffer more until they pass away. Um, so I think it's always like when parents are losing hope to remind them that like we are part of this team together and like we will do absolutely the most that we can for their child, but like with what goal in mind.
How do you how do you deal with that? How do you tell a parent that like their kid's not gonna make it?
It's a really hard conversation. Um, and usually it's not, at least in pediatrics and in my experience, not a conversation that happens like one on one. Usually we'll have like our palliative care team come in and they're incredible. Usually they'll have some kind of like chaplain services if the patients are religious. Um, they also like get trained in end of life care.
Uh-huh.
So they like steer a lot of the conversations. But I think like being transparent in like the kindest way possible is like so important in those moments. Um, I think there is like harm to giving people false hope.
Mm-hmm.
I think we can always say things could be different, but this is what we usually see. This is where we think this child is headed based off of A, B, and C. Like this is the evidence that we have right now, and we see them. Um, and I think it's just like it is a very hard conversation to have. I think like anytime we have it, we do like prepare for it a little bit,
Yeah.
and to have like this like evidence to back us up on what's going on. Usually by the time that that conversation gets there, we've like known the family for a while, so we also like kind of know how they work. Some parents really just want like the cold hard facts and they want it just delivered, like no beating around the bush.
Right.
Like I've had parents like thinking, like ask me like, do you think they're gonna die this week?
Right.
And sometimes you need to just say, yeah. I think
Yeah.
it's like a real possibility.
Right.
Um, so yeah, really tough conversation to
Yeah.
have.
Yeah, I can't even imagine having that, even going into that. You're my big girl, Kristen. Well, Kristen, thank you so much for doing this with me. It means the world a lot, really. Because I mean, that's probably like one of the hardest jobs that anybody could possibly have, and I can't. Me being a mom, we are looking at you guys and wondering like, are they nice? Are they not nice? Are they gonna, you just don't know. You know what I mean? And you guys are like are the saviors because we don't know how to fix stuff. But thank you for reminding us that medicine isn't just knowledge; it's heart, and you have the biggest heart I know.
Oh, thank you.
You're welcome. It's presence, it's long nights, and it's steady hands in unsteady moments. And to anyone that's listening, if this conversation stirred something in you, just sit in that for a minute. There are people in this world who carry so much for others: doctors, patients, caregivers, friends. And sometimes they need someone to hold space for them too, just like Miss Kristen does. If you'd like to explore more of what we share here at Anumi, you can visit www.anumihypnosis.com. Anumi offers guided relaxation sessions, meditation experiences, and supportive conversations designed to help feel grounded and steady through life's heavier seasons. This podcast is for education and personal development purposes only. I do not diagnose, treat medical or mental health conditions, and this content is not suitable for licensed medicine or psychological care. If you need clinical support, please reach out to a qualified professional. So take what feels supportive, leave what doesn't, and just be gentle with yourself. You're not alone. Thanks, Kristen.
You're welcome.